Okay, so today I'm going to be presenting like my quick screen for a patient who I suspect have a right C6 cervical radiculopathy. This would come after my subjective intake, where I would ask them, what their neck pain or what their pain is. That does it shoot down and numbness or tingling, and then just what kind of motion in terms of what motion causes the pain. So first off, I'm just going to do some palpation. So Jody, I'm going to poke you around a little bit. I just want you to tell me if anywhere hurts when I poke it, okay?
Mm-hmm.
So first I would go down cervical paraspinals. No pain? Okay. And then I would move down into upper trap. Any pain here?
No.
Go ahead and cross your right hand over your left shoulder for me.
My right hand.
Over your left shoulder.
For my left shoulder.
And this opens up levator scap. And then I would do the same on the opposite, so go ahead and relax, and then, I'll check left levator scap first, then relax, and then I would check left upper trap in this case. And then I would poke around scalenes. Pain there? No. Okay, and then I would move into my range of motion assessment, starting with active and then applying some overpressure to get a true end feel for the joint. So, Jody, go ahead and look up towards the ceiling for me. Hurt a little bit?
Yeah.
Okay. And then how's that overpressure? Okay. Doesn't make it any better? Okay. Go ahead and make like a double chin for me. Any pain there?
Mm-hmm.
Okay. And then go ahead and turn your head to the right. That one hurt?
A little bit, yeah.
Okay. And then I apply a bit of overpressure.
Yeah.
And then the pain here that she's feeling, this is what I would expect someone with some sort of right-sided neck pain to have, especially with radiculopathy. Go ahead and turn your head toward the left. And overpressure. Okay. Then go ahead and bring your right ear down to your right shoulder. And then some overpressure. It's a little bit of pain.
Yeah.
Okay. And then bring your left ear down to your left shoulder. Bring that down. And then a special test I would do here is the Sperling's test. So Jody, what I'm going to have you do is bring it up and then tilt your head a little bit to the right, and then apply a little bit of overpressure. That hurt?
Yeah.
Yeah. And with someone with this kind of right-sided radiculopathy, I would expect reproduction of symptoms. And then, just to even things out, I would do it on the left.
Nope.
And then I would expect no pain on the left side. With this being a radiculopathy having radicular symptoms, I would expect some sort of dermatomal myotomal change. So with dermatomes, with the C6, I would expect her to feel if I was to do the dermatomal testing, I would expect her to have different sensations on her thumbs, as that's where C6 goes down to.
I do.
And then for reflexes, I would expect her right brachioradialis reflex to be abnormal, so if I was to do it, I wouldn't expect that. So now I'm going to do some shoulder MMT as well, I like to work down the chain when I do my cervical evaluation. So Jody, go ahead and bring your arms out to the side. Move you. So I would say 5 on the left, 4+ on the right. Go ahead and bring your elbows to me. And then don't let me move you. So I'd give a 4- on the right elbow flexion and 5 on the left. I would expect that because the myotomal pattern for C6 is elbow flexion. Go ahead and press into like this again.
Mm-hmm.
Press into my hands. Let me move you. 5 on both sides. And then go ahead and squeeze my fingers. 5 on those sides, those as well. So go ahead and lay on your back for me. And from here, I would do another special test. I would do the distraction test, where I provide that nice distraction on the neck. And the patient says she's feeling symptom relief, which would be a positive distraction test, which would help confirm it being a radiculopathy. Right from there, I would move into my mobility assessment. So C2, normal end feel, 3, 4, 5.
Oh,
And then this next one, C6,
that-
a little bit of pain.
that's a little sore there.
Feels a little bit of hypomobility, which should be expected out of the C6. And then C7. And then for good measure, first rib assessment. Before I check the other side, I also do a grade 3 UPA of the C6. So once again, I find that spot. And it's large amplitude movements up to tissue resistance. So once I find that point, back off, and then just keep applying that to help with mobility purposes. And while I'm here, we'll go ahead and assess the left side of the cervical spine, just to make sure that everything's evened out. Relax. Any pain here? Okay. And that's my screening of a patient I suspect having right-sided C6 cervical radiculopathy.